Diabetes mellitus is a chronic disease that occurs when your blood glucose level is too high or a condition known as hyperglycemia. Any glucose measurement that is higher than these normal ranges must be further investigated to identify the underlying causes. Diabetes mellitus cannot be cured, but fortunately it can be managed. Food can be broken down into many different types of nutrients, such as carbohydrate, vitamins, minerals, fats, and proteins. But glucose is one of the most important nutrients that our body needs as a source of energy. The glucose will then travel through blood circulation to all parts of the body. However, the glucose cannot simply pass through most of the cells directly. Here, when insulin comes into act, in which the function is to help glucose move from blood into the cells. Insulin is a hormone that is produced by beta cells of the pancreas. When a rise in blood glucose level is detected, the pancreas is signaled to release insulin into the bloodstream. The insulin is act like a key where it attaches to the cell and signal it to absorb the circulating glucose. Now the cell can utilize the glucose to generate the energy it needs to function properly. Type 1 diabetes is a condition where the pancreas produces little or no insulin at all. This condition is also known as insulin-dependent diabetes due to the fact that the affected individual is required to take insulin every day. It is usually diagnosed more often in children and young adults. It used to be called juvenile onset diabetes because it often begins in childhood. In type 1 diabetes, the immune system mistakenly attacks the beta cells as if it were foreign invaders. As in autoimmune response, the white blood cells produce autoantibodies that destroy your own beta cells. This results in little insulin production and leads to buildup of glucose in blood that can cause heart disease, blindness, and kidney failure.
Hyperglycemia is a condition when your blood glucose level exceeds the normal limit due to the insufficient production of insulin by pancreatic beta cell. It can lead to the failure of the cell to absorb the glucose. It can also cause an elevation of a glucose in the serum or plasma, which indirectly lead to the increase of blood osmolality. Ketoacidosis is the condition that the body breaks down fats in the process of lipogenesis and produce free fatty acids in order to make energy. Free fatty acid will undergo ketogenesis and produce ketones. Some of the ketone will be excreted in urine after being filtered by the kidney. There are several that accumulate in the blood circulation and finally lead to ketoacidosis. Glucose buildups in the bloodstream as it cannot be absorbed by the cell and cause the water to move out of cell into extracellular fluid. A lot of water being removed from the body by the kidney through frequent urination in order to get rid of unutilized sugar. It can lead to dehydration, excessive thirst, and abnormal presence of a glucose in urine, or also known as glycosuria. When the cell cannot absorb glucose due to low production of insulin, the cell will not have enough glucose to make energy. Therefore, the body will use glucose produced by other metabolic pathways, which lead to gluconeogenesis. This caused weight loss due to dehydration and loss of the calories from sugar that wasn't used as energy. Diabetic distress is an emotional situation where people experience feelings like stress, guilt, or denial that arise due to respond to the threat of life-changing illness. People with type 1 diabetes mellitus at a higher risk of getting mental illness known as diabetic distress. It can be associated with major depressive disorder.
These are the common lab tests and its diagnosis used to diagnose type 1 diabetes mellitus patient, and it includes blood glucose level, HbA1c, plasma acetone level, and urine ketones. Starting off with the first one, which is the blood glucose level. Glucose is a common compound found in their circulation. However, it could either exceed or present in too little amount. This condition would indicate such pathological processes such as diabetes. This test basically determines the level of glucose that is present in the patient's blood. It will give an idea in what state the patient is in. And for type 1 diabetes mellitus patient, the expected result is hyperglycemia. The next test is HbA1c level, a normal physiological process of glucose metabolism. Red blood cells that contains hemoglobin would bind chemically to glucose and it would be present in the bloodstream until it is utilized completely. This is HbA1c. HbA1c level would tell if that patient hemoglobin is still attached to glucose. This test is crucial in determining the average glucose level on the average of several months or weeks. The patients would exert 6.5% or higher level of HbA1c. The next test is urine ketones. Ketones are the byproduct of fat breakdowns when the body uses fats in order to supply the body with energy. This is common in diabetic patients as they could not utilize glucose as their main source of energy. Ketones is toxic when there is a high level of it in the body, and the body would excrete it in urine. Normally, when glucose exceeds the normal level, traces of ketones may be detected in urine sample, and quantitatively, it will be greater than 5 milliequivalent per liter. The last test is plasma acetone level. Ketones or acetone that are present in the body would decrease the blood pH as ketones are acidic in nature. Thus, determining the plasma ketones level are crucial. This test specifically measures the level of beta-hydroxybutyric acid or acetone, and in severe diabetic ketoacidosis cases, this level may exceed up into 25 millimole per liter. Here are a few courses of treatment recommended for type 1 diabetes mellitus patients. The first one is insulin therapy. Type 1 diabetes patients are lacking in insulin as their beta cells from the pancreas are affected. Thus, insulin injections are required to maintain blood sugar levels. The second one is pancreas transplant. Functional beta cells from the donor could be transplanted into the recipient, and these beta cells would secrete additional insulin for the recipient body to use. The last one is controlled diet. High sugar and fast food should be avoided and be taken in moderation, as all of this could raise the blood glucose level in such short amount of time.